President and Vice President are here to discuss all of the work that they have done to lower costs for Americans. And what we know is that men and women across our community, our state, and our nation, they work so hard every single day to provide for their families. Now, some of us are students working hard in school so that we can live a better life. We know that some in our community are caregivers who are working hard to make sure that our loved ones have what they need to stay healthy. We know that there are some who show up for work and they do so before the sun even shows up to start the day. We know that even if our lives look different, we are all doing our part. Now, no matter where we're from or what we look like, don't we all believe that we deserve to have quality food on the table? Yes. We know that our children deserve the single best education that we can provide them. Yes. We know that working people everywhere should share in America's prosperity. Now, I have to say once again, and I know that you agree, that no one believes this more and no one's done it better than President Joe Biden and Vice President Kamala Harris. They have worked tirelessly every single day to lower costs for hardworking families. In fact, lowering costs for Americans is the #1 priority of this administration. And it's clear, they're making progress. Now, President Biden and Vice President Harris have successfully, and this is so significant, capped the out-of-pocket cost of insulin at $35. And this is a part of a bigger fight to lower the cost of prescription drugs. And you're going to hear more details about this today, but it is historic. It is historic for those who have done everything right, those who are like my parents, who've done everything right, who have aged only to find that they cannot afford the cost of out-of-pocket prescription drug medications. Well, the Biden-Harris administration has answered. 10 new drugs now will be lowered as a result of their work. And guess what? They have not stopped there. They've defended Social Security, which, yes, one of the most important social programs of our lifetime, has been protected, have protected our seniors now for 89 years. They have also, for those who've been asking, everyday hardworking people, how do we afford the cost of living? You should know that they have likewise lowered overdraft fees, holding banks accountable when they try to take too much. Now, we're here with some students and some who've been in college or graduate school a long time ago, but let's hear it now for how they have improved the student loan system, helping thousands of borrowers. Yes. Promise made, promise delivered, that they have helped thousands of borrowers to erase their debt while holding loan servicers accountable. Now, they have also cracked down on all kinds of price gouging, junk fees, and have you heard of shrinkflation? This is something also that they are working on. And for those who don't know what that is, have you bought a box of cereal lately only to discover that what's in the box is getting smaller and smaller and smaller, right? Yeah, the greedflation. That means you show up now at the grocery store. How many know that grapes are $9 in the grocery store? So they're cracking down. And guess what? They've never lost sight of a simple fact. America does well when Americans are thriving. So let's thank President Joe Biden and Vice President Kamala Harris for their tireless efforts on behalf of hardworking American families. And I'd also like to say on behalf of Prince George's County, how grateful we are that this is the 3rd time their administration has visited Prince George's County in just the last 2 months. Yes. And so one more time, on their 3rd visit here, let's welcome President Joe Biden and Vice President Kamala Harris to Prince George's County. Thank you.
Please welcome Center for Medicare and Medicaid Services Administrator Chiquita Brooks Lashore.
Hello, everyone. I'm Chiquita Brooks Lashore, the administrator of the Centers for Medicare and Medicaid Services. Our programs cover over 160 million Americans through Medicare, Medicaid and CHIP, and Affordable Care Act coverage. President Biden and Vice President Harris are committed to making care more accessible and affordable than ever, providing high-quality health care for all Americans, no matter what they look like, where they live, or how much money they make. This administration's legacy boasts many firsts, and today's announcement represents a huge first in the history of healthcare, which is decades in the making. Because of the Biden-Harris administration's new prescription drug law, for the first time ever, CMS was able to negotiate directly with drug companies to get a better deal for Medicare. And we did it. We reached agreement on new prices for all 10 drugs selected for the first year of negotiation. These 10 drugs are some of the most costly and frequently used drugs in the Medicare program. These medications treat diabetes, heart disease, rheumatoid arthritis, cancer, and more. This will save billions of dollars, not just for the government, but also directly for the seniors and people with disabilities who are on Medicare. These savings will also help protect Medicare for the long term, so it's just as strong for our children's children. For so many, being able to afford these medications will mean the difference between debilitating illness and living full lives. These negotiated prices, they are not just about costs. They are about helping to make sure your aunt, your mother or father, your grandfather, or you can live longer and healthier. And the prescription drug law has already had an impact. Today, people with Medicare are already receiving meaningful savings on prescription drugs like insulin and vaccinations, so that people don't have to choose between life-saving medications and other basic needs. Next year, every person with Medicare prescription drug coverage will have their costs capped at $2,000. And the 10 drugs that we're announcing today are just the beginning. CMS will be negotiating the price of more drugs in the coming years. We thank President Biden and Vice President Harris for their tireless dedication to improving the health of all Americans. Thank you, and please enjoy the remainder of the program.
Please welcome Department of Health and Human Services, Secretary Javier Becerra.
Wait a minute. I think some of you made a mistake. The Beyonce and Taylor Swift concert is about 5 miles that way. This is for the other two superstars, Joe Biden and Kamala Harris. Okay, I'm going to tell you something you already know. We pay way too much for prescription drugs in America. I know you've heard this story too. How many of you have that grandmother, the uncle, the neighbor who has to cut their pills in half so they can last longer, or who has to skip a dose of the medicine so they can wait till they can afford to buy the next batch of medicines that they need? That is not America, where you cannot take your medicine when you need it. And it is time to fix a broken drug pricing system. So guess what? Someone is doing it. President Joe Biden made a promise. He was going to lower your costs in health care. He was going to make sure more of you had that insurance. And he was going to make sure your benefits were better. Well, take a look at the Inflation Reduction Act. The president delivered on his promise. Today is the proof of that. We are lowering the price of prescription drugs. And guess what? The president was dogged in getting this across the finish line. But it would not have become law unless the Vice President of the United States, Kamala Harris, had cast the tie-breaking vote to make it the law. So if you or someone you know is getting insulin today for your diabetes at $35 or less a month, thank you, Joe Biden, and thank you, Kamala Harris. If you know someone on Medicare who today didn't have to pay a single penny to get that shingles vaccine, you don't want shingles, that shingles vaccine for no cost, thank you, President Joe Biden. Thank you, Vice President Kamala Harris. And if you happen to be one of those unfortunate Americans who has cancer but is fortunate to be on these cancer drugs that might save your life but cost thousands of dollars, and next year, starting next year, the most you'll have to pay out of pocket in Medicare is $2,000 altogether. Thank you, Vice President Kamala Harris. Thank you, President Joe Biden. And I know someone here will recognize the name of Januvia. That is a drug that treats, there we go, there's a hand that went up right there. As you know, that's a drug that treats diabetes, right? You know how much the company that makes Januvia lists it as its cost? $527. Well, we engaged in negotiation because we think we can get a better price. At the end of our negotiations, you know what price they're going to charge Medicare? $113. That's a 79% savings. Some of you may know about the drug Farxiga. That's to treat heart and kidney disease. The drug company that makes Farxiga charges $556 for a month's supply of that drug. We negotiated that drug for Medicare, $178.50. Because President Biden and Vice President Harris made the Inflation Reduction Act, which I call the President and the Vice President's lower cost prescription drug law, because they made it possible, today we can talk about these drugs that you and I and your loved ones need, costing far less, so you can afford to take them as you need them, not cut them up in half, not have to skip a day, because you deserve to have your health regardless of what some drug company wants to make in profits. That's what your right is under this president and this vice president. And guess what? Guess what? Because the president wanted to do right by you and the vice president wanted to do right by you, not only are they reducing the price of those drugs, they're saving us all a ton of money, including all you taxpayers out there who don't take those drugs. Because guess what? This negotiation, just these 10 drugs, is going to save the Medicare program and taxpayers who will pay for it $6 billion 1 year. And those Americans who take one of those 10 drugs today, you pay out of pocket some of your money because sometimes you have to pay some of the money beyond what Medicare pays for you. Those Americans, when these prices take effect, because they won't take effect until January 1st, 2026, but when they do, you all are going to be saving, just in these 10 drugs, about $1.5 billion out of your own personal pockets. And so it makes a difference who's leading this country. And I believe you are ready to see more people like President Joe Biden and Vice President Kamala Harris who want to work for you. And you want people who make a promise and keep it. And we all are going to work really hard because we want to continue to drive down the price of those prescription drugs. Let us do it together under the leadership of our leaders, President Joe Biden and Vice President Kamala Harris. Thank you all very much.
Please welcome Senator Ben Cardin.
Well, hello. President Biden's in the House. Vice President Harris is in the House. Are we ready, Maryland, to say thank you to the President and Vice President? I am so honored to represent you in the United States Senate, and I bring greetings from my seatmate, Chris Van Hollen, who's worked tirelessly to reduce the cost of prescription drugs. He sends his best. He's sorry he couldn't be with us. We do have Team Maryland here. Governor Moore will be here. You heard from County Executive Officer Brooks. We're all here to say thank you. Thank you, President Biden. Thank you, Vice President Harris, for what you've done for Maryland and our nation. You stood by us during the tragedy of the Key Bridge, being with us every step of the way. You protected our Chesapeake Bay. You passed legislation, the PACT Act, to help our veterans. You've helped us with building an infrastructure in our country. You protected jobs with the CHIPS and Science Act. You took on the gun industry with the Safer Communities Act. And 2 years ago, we signed into law the Inflation Reduction Act. We're here to celebrate that. We're here to celebrate what that means. Because as Secretary Becerra just said, it's going to help us control inflation. How? Reducing $6 billion of unnecessary taxpayer costs in the first year with negotiated prescription drug costs. That's a big savings. Thank you, President Biden. Thank you, Vice President Harris. for getting that done. The Inflation Reduction Act helps us, puts a cap on out-of-pocket prescription drug costs. It's going to save you money. And we know the direct savings in regards to insulin at $35 a month cap, saving an average family over $500 a year. These are big savings as a result of the passage of the Inflation Reduction Act. But how did this happen? I got to take you back over 20 years ago, when with only Republican support, Big Pharma won a big victory in Congress when the legislation prohibited the government from negotiating price on prescription drugs. Joe Biden and Kamala Harris did something about that in reversing that policy. The bill that was signed 2 years ago removed that restriction. It was passed by Democratic votes alone, and the controlling vote, the deciding vote, was cast by Vice President Kamala Harris. She passed that because she's President of the Senate. President's a good title for her. So we're here to celebrate. The 10 drugs that we've negotiated those prices, and this is just the beginning. This is just the beginning. Will save in the first year the $6 billion for taxpayers, $1.5 billion for the users of these drugs. These are big victories to celebrate, and that's why we're here, to say thank you to the President, thank you to the Vice President for what you've done for our nation. You've delivered for Maryland, and you've delivered for Americans. And we're here to say thank you, and we're so proud that you are with us today. So let me just conclude by saying thank you for allowing me to represent you in the United States Senate. These last years have been, I think, the most productive because of the leadership of Joe Biden and Kamala Harris. Thank you. God bless.
Please welcome Governor Wes Moore.
What's going on, Maryland? What's going on, Prince George's County? Man, I love y'all back. I love y'all back. Listen, I'm ready. Y'all ready? I got to tell you right now, we got a couple folks who are back here. In a few minutes, you're going to hear from not just the 46th President of the United States, Joe Biden. You're also about to hear from the 47th President of the United States, Kamala Harris. It feels good, don't it? It is great to be here. It is great to be here in Prince George's. It is great to be here at Prince George's Community College. We're some of the most amazing leaders in our state. This is where they are bred. This is where they are trained. And this is where they will continue to lead this state and this country. Prince George's Community College, you are amazing. And I got to tell you, it also feels good to be here, particularly for the kind of announcement that we're about to make. I love you back. But God bless y'all. God bless y'all. Y'all. I love y'all. But listen. Listen. I am so, listen, y'all need to hold up because we're trying to bring the president and vice president out here, y'all. But I'm being serious. I'm being serious when I say how important it is to be here, particularly for the kind of announcement that we're about to make. Because as we've seen, elections have consequences. And the reason that we are about to hear the kind of announcements and the kind of work that have happened is because 4 years ago, we elected Joe Biden and Kamala Harris to be the leaders of our country. And it means a lot being here because, well, people might not know, I was born less than 20 miles away from where we're standing right now. And some of my earliest memories were right in these areas. And some of my most traumatic memories. Because when I was just 3 years old, I watched my father die in front of me because he didn't get the health care that he needed. I don't come from a family that's used to making policies. I come from a family that's used to suffering the consequences of them. And so to be here in this moment, I'm here to say that this moment right now, this is personal. And it's exciting to know that we have an administration who sees us and who fights for us. Because my father had a rare but a treatable virus. But when he went to the hospital, his clothes were disheveled and his face was unshaven. And when my mother showed up at the hospital, they asked my mother questions like, is your husband prone to exaggeration? And he was released from the hospital with the instructions to go home and get some rest. And hours after they released him, he died in front of me. So understanding that we have an obligation to make sure that our healthcare system never overlooks any of us. Knowing that for so many of us here today, we have been shaped by a brokenness of a healthcare system. That we know that we had fundamental work to do because in many cases, the issues that we are discussing, these are not academic. We do not need white papers to explain it because we have grown up in it. So today is an important moment because this is what we know. Today is a chance for us to go from being unseen and untreated. For so many people to not have an opportunity to have basic insurance and know that basic insurance is something that is affordable. Today is a day to know that because of the remarkable leadership of President Biden and Vice President Harris, that this country continues to move forward, and we can and we will be a country that sees all of us and not just some of us. Because what this administration is doing, this administration is saying, we are not just going to pave over the cracks, we're going to fix the infrastructure. This is an administration that has both protected our basic rights and made sure that our basic rights are affordable. And that's what today is all about. That today we join in partnership to announce new efforts to make prescription drugs more affordable through the Inflation Reduction Act, which this administration got done. It is going to ensure that in these United States, that access to critical medication isn't a privilege that is established for a certain few. That access to quality education is not something that we use miserly in this country. But it needs to be something that we all can afford. And we know the movements of this administration that this is not the first and it won't be the last. And they know that in our Maryland, they have a full partner inside this work. That Maryland is going to continue to be a full partner with this administration to protect, to defend, and to strengthen the basic rights that we cherish. That in our Maryland, we are working to lower drug costs through our first in the nation Prescription Drug Affordability Board. That in our Maryland, we are protecting critical investments in Medicaid. Maryland is leading the country in Medicaid re-enrollment, so Maryland families can have access to affordable health care no matter where they call home. And when we're talking about health care, that also includes the fact that in November, we've got a chance to vote, y'all. We've got a referendum on the ballot. And that referendum will be to codify reproductive freedom in our Constitution, because this is health care. So together, we are going to build a future that is more affordable. We are going to build a future that is more accessible. And we are going to build a future that is more just. So whether you are a Marylander who calls Largo home, or Upper Marlboro. We got some UMs in here, huh? That no matter where you call home, you should be able to afford treatment for your arthritis. Whether you are a Marylander that happens to call Suitland home, you should not have to worry about choosing between rent and the drugs that you need that's going to support you after you have a stroke. That together we're going to build a future that people like my father won't be turned away. We're going to build a future where everybody is seen, and everybody's supported, and everybody's cared for. And everybody will know that our future will be incomplete without them. That's our future. That's what we're going to work for. And together with President Biden and future President Kamala Harris, we are going to build a future where we leave no one behind. God bless you guys, and thank you so much for all you are.
Please welcome Judy Aiken.
Hush not, child, and don't cry.
Good afternoon, everybody. My name is Judy Aiken. I'm a 70-year-old retired registered nurse from Portland, Maine, where I live with my husband of 47 years, our 2 beagles, and our son and granddaughter live nearby. Also, for over 4 decades, I've battled psoriatic arthritis and psoriasis that's taken a heavy toll on my body. But nothing could prepare me for the financial strain that came with the high cost of the drugs I need to live my life, including Enbrel, which comes with a staggering list price. Last year alone, I spent over $9,000 out of pocket just to afford this one drug. As a nurse, I counseled patients on the importance of taking their medications consistently, but I have to admit that sometimes I found myself unable to follow my own advice and have been known to skip a dose here and there. For years, it felt like no one was standing up to Big Pharma for patients like me. But thanks to President Biden and Vice President Harris's Inflation Reduction Act, that is changing. Now, Enbrel is one of the first 10 drugs up for Medicare negotiation. The thought of a lower list price for this essential medication feels like a lifeline. President Biden didn't just make a promise, he kept it. Because of the Biden-Harris administration's actions, my husband and I can finally breathe a little easier. That's why it is my great honor to introduce the team who leads the fight to put patients above profits. The President of the United States, Joe Biden, and Vice President Kamala Harris.
It's good to see so many friends. It is good to see so many friends. And I want to thank you. Thank you. And let's please thank you. I love you back. Thank you. And I know we all thank Judy for sharing her story. I think we all know it takes a very special person who has dedicated over 40 years of their life to do the work that Judy has done as a nurse, that work being what? To care about other people in a way that is about lifting them up and caring about their well-being. So Judy, we thank you so very much for being here today. I want to recognize the incredible Governor Wes Moore. Who's here with Don and their son. And Wes, I'm so thankful to you for all that you do in service to our nation in so many different ways, and your friendship, but in particular, to share such a personal story as you have, and I know it takes a lot out of you to share that story, but to do it in a way that is about lifting up other people and helping, hopefully, others who are not in this room, understanding how real people are impacted every day about this issue and by this issue. Thank you. I want to recognize the people of our administration, including Secretary Becerra, who is here, the bold administrator, Brooks LaSour, who is here, my dear friend and former colleague, Senator Ben Cardin, Representative Barragan, the chair of the Congressional Hispanic Caucus, and Representative Mfume for all of your years of leadership. And I want to recognize your next United States Senator, Angela also Brooks. And I've worked with her over the years. I'm telling you, Marilyn, you're going to do a great thing when you send her to the United States Senate. And, of course, I could speak all afternoon about the person that I am standing on this stage with. Extraordinary President Joe Biden. And he's going to speak in a minute, but there's a lot of love in this room for our president. And I think it's for many, many reasons, including few leaders in our nation have done more on so many issues, including to expand access to affordable health care than Joe Biden. And today we take the next step, thank you, Joe, forward in our fight. Thank you, Joe. 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 So, we believe deeply every senior in our nation should be able to live with security, stability, and dignity. And so in the United States of America, no senior should have to choose between either filling their prescription or paying their rent. That's the subject of today. Because we know for far too long, far too many of our seniors have struggled to afford their medication. And as a result, seniors have been forced to spend their time trying to figure out how they are going to be able to fill a prescription like insulin based on the doctor's prescription, which is about saving their life, or whether they'd have to ration their pills to be able to make it stretch through a month. And why, we all know, but let's ask, why are prescription drugs so expensive? I will tell you. Well, one big reason is for years, Big Pharma has often inflated the price of life-saving medications, often charging many times what it would cost to make just to increase their profits. And millions of Americans have suffered as a result. My entire career, I have worked to hold bad actors accountable and lower the cost of prescription drugs. As Attorney General of California, I took on pharmaceutical companies for deceptive marketing and illegally inflating the cost of drugs, and we won billions of dollars. As a United States Senator, I fought to pass laws that would make health care more affordable and accessible for all Americans. And as Vice President, together with Joe Biden, our President, we finally addressed the long-standing issue that for years was one of the biggest challenges on this subject, which was that Medicare was prohibited by law from negotiating lower drug prices. And those costs then got passed on to our seniors, but not anymore. 2 years ago, we gave Medicare the power to negotiate lower prescription drug prices for the first time in history. And here is why that matters. It is nearly impossible for a patient to negotiate lower prices by themselves. Just think about that. Somebody who needs the medication, who may be suffering from a serious illness, that they would by themselves be able to negotiate against a big drug company to lower that prices is virtually impossible. It's one person against a huge corporation. But Medicare represents more than 65 million people. And so Medicare has collective bargaining power. And now Medicare can use that power to go toe-to-toe with Big Pharma and negotiate lower drug prices. Thank you, Joe. And this is to the benefit of not only tens of millions of people on Medicare, but also millions of Americans on Medicare who have long-term disabilities. And understand, as a result of our negotiations, the government will also pay less than for prescription drugs. And think about what that means in terms of helping taxpayers save money, whether or not they take these medications. So all of this is to say, 2 years ago as Vice President, I was proud to cast the tie-breaking vote that sent the bill that gave Medicare the power to negotiate and let it get to the president's desk, and I was proud when our president, Joe Biden, signed that bill into law. In the 2 years since, we've been using this new power to lower the price of life-saving medications, and now to announce the result of those negotiations. It is my eternal and great, great, great honor, I have to tell you, to serve with this most extraordinary human being and American and leader, our President, Joe Biden.
We take care of their own, care of their own. Wherever this flag's flown, we take care of their own. From Chicago to New Orleans, from Memphis to the bone.
Thank you, Kamala. Well, I love you guys, too. I've been waiting for this moment for a long, long time. First time I sponsored a bill to let Medicare negotiate the price of drugs was in 1973 as a freshman senator with a guy named Frank Church from the state of Idaho. Folks, I have an incredible partner. The progress we've made, she's going to make one hell of a president. And Judy, thank you for sharing your story. It's a really one for far too many Americans. People like my dad used to lay in bed at night when they lost his insurance as the company he worked for, staring at the ceiling, literally, and you've all experienced, you know people who have experienced this, wondering What in God's name happened if my wife gets breast cancer, or if I get sick, or my children get seriously ill? What happens? What in God's name, how can we pay for the drugs, prescription drugs? I'm serious. These are the discussions. You know it. Do we have enough insurance? Can we afford the medical bills? We'll have to sell the house to get a second mortgage. There are discussions that took place in my house and your house. Kamala and I both get it. We know it isn't just about health care. It's about your dignity. No, it's about your dignity. It's about peace of mind. It's about security. It's about taking care of your family. It's about giving folks just a little bit more breathing room. That's all. Look, I believe that health care should be a right, not a privilege in America. And Kamala and I are here today to make a major announcement on our efforts to lower the extraordinary high prescription drug prices. Before I do, I want to thank Governor Westmore and members of Congress. I served in the Senate for 270 years. I know I only look 40, but I'm a little bit older. The longest time I was too damn young because I was only about 29 when I got elected. Now I'm too damn old. But I'll tell you one thing in between. One of the finest, most decent men I've ever worked with. When I think of integrity, is Ben Cardin. Stand up, Ben. Stand up. I really mean it. I measure the people I work with by their integrity. He does what he says and says what he does. Look, folks, also, Nanette Barragan, for the longest time, she tried to pretend with me she was Irish, her name Barragan. She's a great friend, and she's one of the great leaders in this country for the Hispanic community. Congressman Fume, where are you? Stand up, man. I've never once gone to this man and asked for help and I haven't gotten it. Not one single time. Thank you, pal. Thank you. And your soon-to-be senator. Where is she? It's a hell of a lot easier job than being a county executive. I was a county official. They expect you can solve every problem. You don't have the authority to do it. You don't have enough money. But I'm looking forward. I told her I campaigned for or against whichever helped the most. Along with members of my administration, Javier Becerra, HHS, Administrator Brooks LaSalle, CMS administrators here today. And let me say something. We're all thinking about my good friend, and he is a really good friend for a long time, Steny Hoyer. He represents the western shore of Delaware. Y'all think we're kidding. We have that fight all the time. I wish him a speedy recovery. I understand he's doing well. Folks, this is a fight all of us have been fighting for a long time, taking on Big Pharma. We pay more for prescription drugs. It's not hyperbole. We pay more for prescription drugs than any advanced nation in the world. I could take you out on Air Force One, and if you have a prescription from a drug company in America, and fly you to Toronto, Canada, fly you to Paris, France, fly you to Belgium, fly you anywhere around the world, and get you the same prescription filled for the same company for 40 to 60% less than we pay for it here. Too many Americans can't afford the drugs they badly need for life and death. So they skip doses, cut pills in half, forego prescriptions entirely because the prescription drugs are totally unaffordable. The woman you all met, the nurse you just met, she's paid $900 a month. Well, guess what, man? She's going to pay nowhere near that. $9,000. She's going to pay, guess what? Beginning January, every single prescription drug she has including, God forbid, if she needs a really expensive drug like a cancer drug. Maximum she ever has to pay is $2,000, period. That's why from the time I was in the Senate, I worked tirelessly to give Medicare the power to negotiate lower drug prices, just like the Department of Veterans Affairs. In fact, I was reminded by staff today, one of the first major bills I worked on was in 1973. I co-sponsored legislation led by Senator Frank Church that let Medicare negotiate the cost of drugs. 1973, this fight's been going on. You know, the VA pays, as they should, 50% less than Medicare because VA can negotiate the prices. But for years, Big Pharma blocked Medicare from negotiating lower drug prices. As a consequence, they're able to maintain the exorbitant price increases and the profits are uncalled for. Look, but this time we finally beat Big Pharma. And I might add, with no help from Republicans, not a single Republican voted for this bill, period. Not one in the entire Congress. Now, the reason I say that is not to make a political point about them, not if they've gotten their lesson, but guess what? They want to, the guy we're running against, what's his name? Donald Dump or Donald, whatever. They want to get rid of this, what we passed. They're fighting to get rid of what we've just passed. No, I'm serious. No help from Republicans passed the Inflation Reduction Act thanks to the tie-breaking vote of Kamala made it possible. Folks, it really matters. For example, take the insulin needed to treat diabetes. The guy who invented that insulin 100 years ago didn't put a patent on it because he wanted it to be available for everybody. He didn't even patent it. Well, guess you know how much it costs those companies to make that insulin? $10, T-E-N. That's the God's truth. $10, number one. Number two, to package it and ship it, you might get it up to $13. But they were charging up to $400 a month for it. But now they can't charge more than $35 a month. It's a big deal. Oh, look, $35 a month. These guys still make enormous profits. That's 3 times what it cost them to make it. The initial legislation capped the cost for everyone who needed that insulin. How many of you know anybody needs insulin for diabetes? Raise your hand. Okay, well, guess what? For the next 3 months we got here, I'm not leaving here, and Kamala, when she's president, going to make sure if we don't get it done, everybody should qualify for that $35 a month. Every American. I mean it. Folks, that's not all. The same law we wrote, means starting in January of this year, every senior in the United States of America, no matter what their cost of drugs, and like I said, some of these cancer drugs are $12,000 a year. Every single penny they spend, they never have to spend more than $2,000 a year for all drugs. All drugs. And we're going to fight to make sure everyone qualifies for that as well. Look, all together, our reforms not only save lives, but here's the point people don't talk enough about. It saves the taxpayers billions of dollars. What we've done so far will save the taxpayers over the next 10 years $160 billion. Taxpayers, lowering the debt. I mean it. Because they don't have to pay the exorbitant price that Medicare had to pay before. They're going to pay $35 instead of $400. Folks, and those savings are only going to increase for American taxpayers because it matters. Look, but that's not all the Inflation Reduction Act did. Last summer, I announced under that law Medicare is going to select, and it's already passed law, 10 drugs a year, going up to 20 till we get every single drug every year. Drugs treat from everything from heart failure blood clots, kidney disease, arthritis, blood cancers, and more. And today, I'm proud to announce that Medicare has reached agreement with all manufacturers on all 10 drugs selected in the first round of negotiations. The new lower prices for all 10 drugs will go into effect in January of 2026, not this January, next January. Negotiations cut the price of these 10 drugs for Judy and others who are Medicare nearly 40 to 80%, depending which drug it is. Let me give you one example. Non-insulin diabetes drugs cost $530 a month. Some of you may know that. Guess what? It's now only going to cost $115. By the way, these new prices on 10 drugs will cumulatively mean $1.5 billion less out of pocket for patients to the drug companies. Lower copays for many of the 9 million seniors who take these drugs. But that's not all. We're also saving the American taxpayer because of the new changes, $6 billion a year, because Medicare won't have to pay out them. Imagine that. $6 billion a year. But we could do that for child care and health care and so much more. We're just getting started. Under the law I signed, Medicare can negotiate lower prices for another 15 drugs next year, 15 the following, and 20 after that till every drug is covered. That's the law. Now. This is another really big deal. It means that Americans can save more money on from life-saving medications they need and deserve. And bring peace of mind. It's hard to explain. Kamala and I are going to keep fighting to lower the prescription drug costs for everyone, not just seniors. It's a fight that we have to continue. Folks, but guess what? Surprise, surprise. Big Pharma doesn't want this to happen at all. The pharmaceutical industry last year spent $400 million lobbying the Congress to stop this. $400 million. Worked pretty well. They didn't get one Republican voted against them. They all voted for him. Republican allies stuck with them. And the ability of the federal government to negotiate lower drug prices was tried to be stopped. But Kamala and all of us in this room are going to keep standing up for Big Pharma. I fought too damn hard to yield now. We're not backing down. And get this, you may have heard about the MAGA Republican Project 2025 plan. They want to repeal Medicare's power to negotiate drug prices. Let Big Pharma back to charging whatever they want. Let me tell you what our Project 2025 is. Beat the hell out of them. I mean it. In January 25, total prescription drugs costs will be capped at $2,000, no matter how expensive they are. And some are expensive as $12 a year, $12,000 a month, I should say. Kamala Harris and Democrats in Congress will make sure that $2,000 cap covers everyone, not just seniors as well. Insulin costs just $35 for everyone, not just seniors. Our Project 25 will lower prescription drug costs for you, your families, instead of handing Big Pharma a big blank check. And look, and in the process, this is what we don't talk enough about, I don't think. In the process, we're going to save the taxpayer. The budget's going to be reduced by hundreds of billions of dollars. Hear me? Hundreds of billions of dollars. Just the first year, the first thing we passed, is $160 billion less that the government's going to have to pay out to farmers. But guess what? It can pay out for education, it can pay out for health care, it can pay out for so much more, or it can just simply reduce the deficit. He has exploded. Folks, that's what I call a win. Folks, there's more. My predecessor and his MAGA friends in Congress tried to repeal the Affordable Care Act, which is different. Obamacare. They tried to repeal it over 50 times. We stopped them. Along the way, I made the Affordable Care Act even stronger, protecting a million more Americans with pre-existing conditions. And guess what? There's over 40 million MAGA Republicans in Congress don't want to cut Medicare, and so they want to cut Medicare and Social Security. Why? They want to give another, here's what they're proposing, just so you know what the budget is. They're proposing another $5 trillion tax cut for the mega wealthy. By the way, this guy we're running against, when he was president, he gave a $2 trillion tax cut to super wealthy. You know what that was? He generated the largest deficit any president has in American history. I love these Republicans talking about cutting spending. You know, we have 1,000 billionaires in America. You know what their average tax they pay is? 8.2%. Introduced a bill to say that you got to pay a minimum of 25%. You know what that would raise? $500 billion over the next 10 years. Imagine what we could do with that. Imagine the taxes we could cut for ordinary people. Well, look, Kamala and I have a better idea. We're going to protect Medicare and Social Security and make sure the wealthy pay their fair share. That's how we're going to pay for it. And by the way, that means making the tax code fair. Look, in addition, we're also announced steps to crack down on anti-competitive practices in health care. How many of you know we've been going after things called junk fees? Junk health insurance plans. Ones that look affordable. When you take the cover off, you find out there's a number of hidden costs. We're going after them and trying to get rid of them. We're also cracking down on surprise medical billing. For example, when a patient goes in the hospital for surgery, if it turns out his anesthesiologist is not in his network, you're going to get a surprise bill for another $1,000. Well, we're stopping that too. We're protecting 1 million healthcare providers. We're protecting 1 million Americans every month from unexpected medical bills. We're working to ban the use of medical debt on credit reporting. Years ago, I had 2 craniotomies because I had aneurysms. My bill, if I didn't have insurance, was in the hundreds of thousands of dollars. Well, guess what? It matters. It matters whether or not, if I didn't have insurance the rest of my life, I couldn't do anything. I wouldn't be able to buy anything, wouldn't be able to have a credit, wouldn't be able to. Now, we're going to get rid of health care costs being on your, you have to still owe it, but you don't have to get your credit doesn't affect it. Look, I'm a capitalist. I have no problem with companies making money, but not by price gouging seniors and working families. I grew up in a family where my dad used to say, Joey, a job's about a lot more than a paycheck. It's about your dignity. It's about respect. And I really mean this. This is what he would say. My dad was a well-read guy, never got a chance to go to college. He talked about what we needed to do for ordinary working, hard-working people. We changed the whole way we look at the economy. It used to be this idea of trickle-down economics. Even Democrats accepted it. Some Democratic presidents accepted it. That if you're wealthy, makes a lot of money, it'll trickle down to the rest of us. Well, I didn't notice a single penny trickle down on my dad's kitchen table. But guess what now? We measure everything the following way. We build from the middle out and the bottom up, and if they do well, everybody does well. Not a joke. And any money I get to spend as president, I spend it on being made in America by Americans. Americans don't like being played for suckers. We believe we should be patient, but there should be reasonable profits, not unreasonable profits. Look, let me close with this. It's all about health care. It's about lowering costs for families. It's about fairness and security. It's about the dignity for people like Judy and millions of Americans all across the country. That's exactly what we're doing. There's more we can do for everyone. We can't give up. They told me every major piece of legislation we passed to give us the strongest economy in history and the strongest economy in the world. We got more to do for working people. And by the way, everybody does better when there's more unions. But we're finally getting it done. We can't stop now. We just have to remember who in the hell we are. We're the United States of America. There's nothing beyond our capacity in this country. We work together. Nothing. I'll tell you what, I thank God that in the last 3 months I'm President of the United States, I was able to finally get done what I tried to get done when I was a young senator at 30 years old. Thank you, God. Thank you. God bless you all. May God protect our troops. Thank you.